Lacerations are serious business. Wound closure and suturing are vital skills that have been practiced for thousands of years, dating back to the Egyptians in 2000 BC. While most superficial wounds will heal without intervention, lacerations extending into the subcutaneous tissue should be evaluated for more advanced closure with suture. Contraindications to suturing include redness, edema of wound margins, infection, fever, puncture wounds, animal bites, tendon, nerve, or vessel involvement, wound greater than 12 hours old, and foreign bodies in the wound. When in doubt, leave it open. Potential complications to suturing include infection, scarring or keloid formation, loss of structure or function, tetanus, wound reopening, and a cosmetically ugly outcome. To prepare the patient, discuss possible tetanus booster or vaccination. Use local anesthetic, either lidocaine for a shorter block or bupivacaine for a longer block. Irrigate the wound with saline and debride the edges. Before suturing, it's best to explore the wound for foreign bodies, tendon, fascia, muscle, or nerve or vessel injury, and for the base of the wound. To perform the horizontal mattress stitch, start on the vascular side and exit on the relatively avascular side. Re-enter backhanded on this avascular side parallel to the wound edge and adjacent to the original exit site. The final exit is on the original vascular side. Perform your instrument tie. The indications for a horizontal mattress suture are when there is a flap of tissue, hand lacerations, high-tension wounds, vascular and avascular side to the wound, or fragile or elderly skin. This suture runs parallel to the wound.
Always have and I always will. There ain't no other kind of music in the world that gives me quite the thrill. When I hear 60-minute man and walking up a one-way street, he's up on the roof, he's under the boardwalk, summertime they're calling me. Beach music. Beach music. I love beach music, 'cause I was born with it in my bones. I learned to shag on the beach with the salt in the air and the sand at my feet. Yeah, ooh, Miss Grace.
To perform the vertical mattress stitch, introduce the needle far and exit far from the wound edge. Dive deep, but just superficial to the wound depth. Next, starting on the same side as the first exit point, load the needle backhand and enter near the wound edge. Then exit on the original side near the wound edge, both at a level more superficial than the original deep first pass. Now perform your instrument tie. Vertical mattress suture is indicated for deep wounds, dead space closure, and lacerations over areas with lax skin. This stitch runs perpendicular to the wound. The far stitch should go in at 90 degrees deep into the skin.
Beach music. I love beach music, 'cause I was born with it in my bones. I learned to shag on the beach with the salt in the air and the sand at my feet. Yeah,
Follow-up instructions to suturing include: keep the wound site clean and dry for at least 24 hours, but preferably 48 hours. Avoid prolonged soaking of the site in water. Consider possible activity restriction. Antibiotics may be prescribed based on the type of wound, for example, bite wounds, crush wounds, or heavily contaminated wounds. Suture removal depends on the anatomic location. In the face, it's usually 3 to 5 days, 7 to 10 days for non-tension areas, and 10 to 14 days for tension areas. In conclusion, these lovely locks can serve many practical purposes while out in the field. Thank you, and have a good night.